I had this long wait list for these are animals with chronic problems. And, I'd really like to be able to see them. So I kept taking them onto a wait list. And then I said to my receptionist, how many do I have? She went through there and she said, you've got over 100. And so I said, we have to stop this. We can't keep having people have hope that they might be able to get in when it might not be 2 years or something. So I said, we're going to stop the wait list and we're just going to get through these people as quickly as we can. So trying to get them in.
Tell us a little bit about who you are.
I moved up to Collingwood from Toronto about 17 years ago for a lifestyle change because I love the outdoors, and this is an outdoor place. So my hobbies are things like skiing and sailing and hiking and bicycling, everything outside, and gardening.
Tell us about how you use ozone in your clinic. What does that look like?
Well, I mean, we use it for many different things. I say the most common one that we're using is rectal, combined with minor autohemotherapy. We're using it a lot for digestive issues. In fact, I have a cat that I just saw this morning, and I just told the girls we're going to do some, she's got chronic diarrhea. We don't know the cause of it yet, but we're going to give her some rectal ozone and minor autohemotherapy, and just give her a little kickstart while we're waiting on some test results back. Got another dog coming in today that has some cysts that they might be infected. They might be, I'm not sure what they look like, but they might be open, and we're thinking we might be flushing that with some ozone saline to just kind of clean it all out, and then we'll decide what to do from there. I mean, we could even do some ozone gas injections around it or something like that to help decrease the inflammation that's going on. So,
great, awesome. So was it something that was difficult to get into off the bat, like feeling overwhelming or anything like that? Or how did you guys?
No, this is the funny thing about it. I was at a veterinary class reunion not long ago, and I was talking to some of my classmates about ozone therapy, and somebody says, oh, there must be a huge learning curve. And I said, no, any veterinarian with veterinary training can do this. You don't have to be a holistic vet to do it. And I would love to see more regular vets getting this, because it's so helpful for all the animals, and it's not harmful, and it's so simple to learn how to do it. I heard about ozone therapy, I think it was back in 2019, before COVID.
Okay.
And I was renting space out of another practice. So I spoke with one of my friends who was practicing ozone therapy, and she said, well, it's really best if you could have a technician doing all the treatments. You guide them, and then you have the technician do the treatments. And I said, well, I'm not in a situation where I can do that. So I started using your oils instead. So that was my first thing. And then with COVID, I just realized I really needed to open up my own place, have my own staff, so that I could do all these other things. And so ozone therapy was one of the reasons that I decided to get out on my own and open up my own place. So
that's awesome.
And so that was the first modality I reached for, also outside of my regular holistic training, because I do Chinese medicine, acupuncture, and herbs and that type of thing.
Do you see that it works synergistically? Like, is it a problem to do alongside of those things, or have you had pretty good results with doing them in conjunction?
We've had great results doing it in conjunction. Yeah. So in some of my patients, I'll actually take the ozone gas and I'll actually inject it into the acupuncture points, or I'll use ozone saline and inject it into those areas and then put the needles in. So it works very well in combination that way. But I've also, I'll actually have needles in the patient, and then my technician will come in and do the rectal ozone. And the patient doesn't care. It's so easy to do, and they don't really mind. And most of these patients that I'm seeing are ones that I've been treating for a little while, so they're very comfortable with me and very comfortable with the ozone therapy. We have one, actually, when we used to give it to him, he would get so much energy afterwards. He would just be bouncing around all over the place.
Oh, cool. So is there like one, I guess, patient story that stands out to you as, just a good result that was exciting?
Yeah, I was thinking about that one. There's a number of them, but one that really kind of stands out is this young dog. We had done a dental on her well, I guess it was about a year before. And she ended up with a stricture, so scar tissue in her esophagus, which goes from her mouth down to her stomach. And this narrowing caused her not to be able to eat food in a normal fashion. She had to have it made into a mush. And sometimes she would get into something and then she would end up gagging, and then the piece of whatever would come up. Sometimes she would get so much phlegm, there was phlegm stuck at the back of her throat and she couldn't swallow. So we were using herbs and I was using acupuncture therapy, and we were able to get her to eat and feel better, but she was still having these incidences quite often. And we decided to start ozone therapy. So we combined rectal ozone therapy with minor. And then we also, because her tonsils would get really enlarged in the back of her throat, and because I knew she had inflammation down her esophagus, we would get her some ozone water to drink also. And since we've started that, she rarely ever has a gagging episode, and she can actually eat more of a solid type of food as long as it's really small. So, I mean, that's made a big difference for her.
Wow, great. And how did you administer it again? Can you give us a little bit of detail, or do you, if you remember, on how you would administer it, how frequently, and things like that?
Well, we first started off with the 3 modalities on a once-a-week basis, and I think we did that. It was either for 4 or 6 weeks, and by that time we were seeing less incidences of her gagging. The mom calls it accordion because the dog would get something stuck there and she would go like, back and forth like an accordion, going back and forth. So we weren't seeing that anymore. So then we started to decrease the frequency to about every, I think we did every 2 weeks, and then spread it to once a month. And now we're doing it about once every 3 months. And she's going to go away on holiday for 3 months. So we'll give her another ozone therapy before she leaves, and hopefully that will tide her over for the 3 months when she's away.